something. But anyway, today is office hours. Forgive my appearance, but I've been traveling. It's my first day off, and I have a concert tonight. So I got to keep my hair all nice and crisp for the concert. So anyway, what is the purpose of the live? The purpose is for me to answer whatever questions you have, whether it's about CNA, nursing, CPR. I am here to assist you. So good morning, everybody. And I will just keep working and recording. And if you all have a question, just put it in the chat. There. What questions do you have? Let's see. Hey, everybody. Welcome in. Do you have any questions? Any questions? Any questions? What questions do you have about CNA, about CPR? Good morning, good morning, good morning. Any questions? Office hours with Nurse Eunice. Let's see if we have any questions. Good morning, everybody. I'm trying to read the questions. Looks like we may have one. Let me go to my phone to see if you have any questions. Maybe I can see it from there. Right, so this is unscripted. So if you all have questions, you have to put it in the chat. All right, and I have my other phone out. So what questions can I answer for you? There we go. All right, put those questions in the chat. Good morning, Sasha. How are you doing today? Do you have any questions for me? Hello, hello, hello. Let's see if I can see the names better over here. Good morning. Sophia, good morning. So we have Sasha, we have Sophia. And do you have any questions? Anything you have concerns about? Good morning. How's life treating you? Tomorrow, please pray for me. Watch your video. Of course, is your exam tomorrow? Yes, I see it there. Your exam is tomorrow. So I'm going to pray for you right now. Lord, please give her the strength, the wisdom, the courage that she needs. She's been preparing, she's been studying, and she is more than able to pass that test tomorrow. In your name we pray, amen. You're going to pass that test, and you're going to come back and you're going to give us those good results. So your nerves, it's okay to be nervous. In most of your test sites, if you make a mistake, you can say correction. So if you make a mistake, you can verbalize the word correction and your nurse will ask. And I'm not sure if you're doing your written exam or your skills tomorrow. In Florida, we do both of those exams on the same day. So written test, I know you're going to ace that. Clinical test, you make a mistake, just breathe, say correction, and your nurse will let you know if you can start over again. So good luck, young lady. You are so welcome. All right. And so I said, Okia says good night. Oh, you're in Nigeria. Yes, good night. Thank you for tuning in. So, Regina from Roanoke, Virginia, hello. Do you all have any questions? I'm going to just hang around, and if you have questions, this is unscripted. Your question can be about anything. So, CNA, nurse, CPR, how to grow a business, how to start a business, how to do content creation. So, whatever you have questions about, I'm here to help you. I'm going to check emails while you were putting those questions in. Okay, you're from New York and you're doing both the same day. You're going to do well. You're going to do well. And I don't care what's going on at the test site. Don't get distracted by what other people have going on. Remember, this is your test. Someone may complete their written portion of the test faster than you. That is okay. In Florida, we have 60 questions in 90 minutes. So it's okay if you take all 90 minutes, as long as you know that, you're confident with the words. And, if you haven't studied terminology, that is usually the part that confuses people. But if you've been watching our channel, I know that you know your terminology. So I know you're going to do well. All right, let's see who is else. Anyone else on here? Regina, do you have any questions? How's life in Roanoke? Let's see. I left Florida, went to California. It was so hot in California. I wasn't expecting for it to be that hot. And then the temperature just drops. So then it got really cold. And so now I'm back in Florida. So let's see. What's an example of must I look for? So when you're at the test site, I'm going to do an introduction. And when I knock, even though I can't hear you, just say come in. Hi, good morning. My name is Eunice. I'm your CNA today, and I'm here to take your pulse. So your skills card will have the skills that the computer selected for you to perform. You'll perform one skill at a time. So even if it's at pulse, foot care, feeding, you're not going in trying to do all 3 skills at once. You treat those skills as if they're individual patients. And every time you enter a patient's room, what must you do? You must knock, introduce yourself, and then of course we start off with clean hands. So hello, my name is Eunice. I'm your CNA today, and I'm here to take your pulse. Is that okay? Of course, the person at the test site is going to say yes. Before I begin, I'm going to go wash my hands. And then after you wash your hands, I have our students wash their hands first and then close the curtain, only because hand washing is a failing point. You closing that curtain will be a little minor mark off if you forget to close the curtain. You can always go back later and say, correction, I forgot to close the curtain. But if you forget to wash your hands, you're going to fail your test. So we start off with hand washing. So after the hands are washed, that's when we'll address the curtain and then the call button that's in your patient's hands. So after you do your intro, that's when you can gather your supplies and then put them in their proper position. Because if, for pulse, the position is okay, but for feeding, they may not have the person sitting all the way up. So just focus on your intro and your exit right now for your skills, because I know that you're ready. Let's talk about the exit. Whenever you're exiting your skills, whenever you're completing them, you have to give them back the call button, the call bell. And then you're going to ask, is there anything else that they need? And then from there, if it was a skill that required you to maybe empty out urine contents or take a pulse, make sure that you document. In Florida, we don't have to document every skill. We have to document the skills that would result in a number. So make sure you document. So at the end of your skill, it's going to be give them back their call bell, wash your hands, document your findings, and open that curtain. So the acronym we use is HCC. So it's 3 things we address during the beginning, and then HCCD, 4 things we address at the end. So in the beginning, we address our hands, our curtain, and our call bell. At the end, and not in this order, we address hands, curtain, call bell, and documentation. And whenever you watch our full skills video, we talk about that. That's the very first video. All right, I see there are a lot of questions. Good morning, everybody. So let me go back and look at some of these other questions. Good morning. Just want to let you know I've been watching you and I got my acceptance letter. I am so proud of you. Congratulations to nursing school, and I start my clinicals in January. I am so proud of you. Congratulations, nurse tears. Rock on. Let's see. Good morning, Thrive Digital. Let's see. All right, so what other questions do you all have? I'm gonna stay on this channel for about another 10 minutes, and then I'm gonna go over to my other channel and do a live there, because I've not been able to create a question and answer video in a few days. It's been a rough week. All right, rough in a good way. All good things is just a lot where I haven't had structured time to come on and do questions and answers. All right, let's see who else we have. Hi, Handy Yam. Oh, Ham, Hamad. I'm sorry if I mispronounced, but good morning. Good morning. Do you have any questions? I think it's Hamdi. Do you have any questions, dear? And then Sherelle said, where are you located? I'm in Jacksonville, Florida. So we're on the near the state line of Georgia. So I'm in Northeast Florida. Where are you located? Let's see, we had one person from Virginia, another one from New York. We had someone from Nigeria. Any mnemonics for donning and doffing? No, I don't have any mnemonics for that one, but I'm surprised I don't have any gloves like laying next to me, so I would just show you how to don and doff. Are you referring to PPE in general? Because I should have like a whole graphic on that, but I don't have a mnemonic for it, so I do apologize. Where will I get more medication aid? When we'll do more medication aid questions? That's a great question. We're actually working on a whole book for that, so I'm going to say January because I don't want to put any pressure, but let me see. I see your name, and so what I'll do is I will look for you. Let me make sure. I'm going to go ahead and if I'm not subscribed to your channel, subscribe right now. I'm your first subscriber. And in that way, whenever I do post that video, I'm going to tag you, okay? And that way you'll get more medication aid questions. Great question. Watching you for a long time and would love to attend your institution. Well, we're in Florida. You're welcome. You all, we have a small business. We do all this training, but we have a small business, like 2,000 square feet. So we're not like a college. We are a training academy where we upskill people. Whatever you need to know, we're there to teach you as long as it's within your scope of practice. So for our nursing students, and when I say nursing students, these are the ones who are at the end of their program. They're going to graduate and they have already completed their program. They're going to be taking their exit exam, their NCLEX. Their last year exam. So we do IV therapy classes, we do review classes for them. For those entering the nursing field, we do CNA. We have the 40-hour med tech course coming out in January. And so for Florida, that means that you've been a CNA for a year, and now you can take this 40-hour course, which is hybrid, 26 hours online and 14 hours at our location. And we're going to prepare you to give medications in your facilities. So that would not be someone who's going to be working in a hospital. Usually the med techs or the med aides are the ones who work in group homes and also assisted living facilities, because in hospitals they have enough nurses. So the nurses will be passing the medication. So that's kind of what we do. So when you say institution, I love that term, but it's a small training facility and we do really good work. All right, let me see what other questions. You're so welcome. I'm going to try to subscribe to all of you all. Let's see if I have time here. Let's see, watching you. Yeah, see, you probably hear this often, but has anyone today told you you're very pretty? Thank you so much, Quinn. And the natural with no makeup. I love you. So the reason why I look like this right now, it's because I have a concert tonight. I'm going to go see Brandy and Monica. Yes, I'm aging myself. And I'm going to sing until my heart's content. And so my hair needs to be pretty for tonight. So that's why I look like this right now. But I do appreciate you all. And later today, I'll look like what I look like on my thumbnail. So thank you. I love you. All right. So any other questions? Questions about life? What questions do you have? Entering nursing school. Are you going to be a nurse? Are you thinking about physical therapy, occupational therapy, speech therapy? I met a student yesterday on the flight from Montana, and she's going into neuroscience. So there are just so many avenues. She's going to be studying the brain, doing research that you can do in healthcare. Let's see. Looks like someone removed their message. All right, so I'm just going to hang around. I'm going to answer emails until you all show questions that you have for me. Are you all ready for the holidays? our holiday, I mean, like all the kids in our family are of age now to where we don't have to buy them anything. We just give them the money. So like holiday shopping is so simple. It's just like, hey, Merry Christmas. Here's your money. Here's your gift card. And so, yeah, life is getting easier for me. All right, Quinn, I'm ready for the question. Hey, Namji, I hope I'm pronouncing that correctly. Good morning or good evening, depending on where you are in the world. Thank you so much, T. You know what? I think it's just being a nurse. I am, a patient advocate. And so you're advocating for all these patients, regardless of their race, their religion, their sexuality. I could care less. I am going hard for my patients. And so now I take that same attitude towards education. Some of, especially with being in academia, working in colleges, these students were smart enough to get into the nursing program. So why are they failing their clinicals? Like, what's this mental block? You're super smart. I need for your hands and your brain to work together. So, just being able to work with so many different people from so many different backgrounds is definitely a blessing. And so thank you for, that kind statement. I appreciate you. Quinn, I'm gonna let me get a moderator in here. Quinn, someone tap Quinn on his hand since I can't hit him. All right, so Quinn, let me make Sherry or Sherelle a moderator. There we go. I'll see who else I can make a moderator. I'm gonna make Hamdi a moderator. Perfect. One of you all put put Quinn in timeout. Okay, Quinn. Quinn, ask a real question. All right, so you all don't have any questions for me? No questions. All right, I'm going to sign off here and go over to my next channel. So I'm going to go ahead. Oh, there's one. That's why I watch you every night, because you are, thank you so much, Explain. We're in the college, and that's how I'm passing. Your medical terminology is on point. Thank you so much. Yeah, it's once you, finish your studies, you're going to see how education is lacking. And how some people don't really give it their all. They don't try to break it down, and maybe they don't know it needs to be broken down. But it's so much for you all to learn. Your textbooks are sometimes 1,000 pages, and you can't absorb all that. You need somebody who can help you break it down into smaller chunks so that you can understand it better. And that's how you're going to be more successful. And that's also how you're going to remember a large amount of content. So I said all that to say this. Remember what you don't like about whatever school you're in right now, and then take that in the future and build upon it and create your own curriculum, because anything that you all do, you can start teaching it. So whether that's nursing, whether it's respiratory therapy, just start building your own content, and you're going to be a better teacher because you're going to remember what you didn't get in school, and you're going to give that to your students instead. All right. You make CNA very simple. Thank you so much. Thank you. And we're trying to make it fun. You are in 2026. We got to create all these videos all over again. So we'll redo more videos. Again, we have qualified medication aid coming out, which is the med tech course for Florida, the 40-hour course. We do IV therapy for new grads and for nurses. We also do phlebotomy for CNAs, MAs, so and also nurses, because believe it or not, nursing school doesn't, really teach you a whole bunch about starting IVs or drawing blood. So now you're a nurse, and your skills, you like confidence. So we're a safe place for you to come and learn your skills. And so that's what we pride ourselves on. All right, so if you all don't have any questions, I'm going to the other channel. I'm going to put that in the chat right now. And that one would be at Eunice Mathis. And I will try to do more of these open office hours where you all can come in with your questions, but have some questions for me because I want to see you all succeed. I want to help you in ways, sometimes we're doing those questions, the practice questions. I really can't stop and answer your questions like that. So we'll schedule office hours and I'll see you all in the next video. Bye, everybody.